name is Susan Tsai. I am a minimally invasive gynecologic surgeon at Northwestern Medicine. My dad was a physician. He was an anesthesiologist, so he would go in all hours of the night. I did a rotation at that hospital with one of his local OBGYNs. I knew at that point I didn't want to do deliveries. What I really got sucked into was surgery. So during med school, I had the opportunity to work with this local OBGYN who was an alumni of my medical school, and I did a month of gynecologic surgery with him, even C-sections, and I was his first assist. I think it was more women's health and being able to work with the population that is like me and potentially has the same problems as me. And so much of women's health is kind of forgotten in this particular case. Unless you ask patients what their bleeding pattern is, they're not going to be forthcoming. We see so many women who are, think that this is normal, and they never bring it up with potentially their primary care doctor until someone maybe does a blood test and notes that they're so anemic and their blood count's so low, or they've gone through life with such heavy periods that they are so low on the blood counts that they have had multiple blood transfusions. So we as women have to be really conscientious about asking those questions, because that is not a normal part of life. And so to be able to really help those women or people with really large fibroids that are having a lot of pain, they're so grateful once we are able to take these things out. So here at Northwestern Medicine downtown, we have trainees at all levels. Without them, we cannot do our surgeries at all. We will normally have a resident. Dr. Denise Monti is our third-year resident today, helping us out on our cases. She is our minimally invasive gynecologic surgery resident for the month. Dr. Yu is our second-year fellow out of our 2-year fellowship, so she'll be finishing up in end of July. And without them, again, we can't do these cases ourselves, so we appreciate every single one of them. Having a training program, either a residency or a fellowship, is fantastic. It keeps us on our toes and keeps us up to date on the literature that's out there and changes that are made in medicine. And we are teaching future physicians that are going to be out there doing the same things, and we want them to be safe doing it, and we want them to feel confident doing it. When I was a trainee, we just kind of went in and they kind of asked you about the procedure and made you do it, and now we really focus on particular portions of the procedure that the resident or the fellow feels like they want to work on the most.